Almost 1 year ago, we had Publicis Health Media CEO Andrea Palmer on the podcast to preview the agency's two-day HealthFront conference. We then spent the trend segment analyzing the impact of HHS Secretary Robert F. Kennedy Jr. on pharma manufacturers and vaccine policy. This week, Andrea returns to the show to preview the agency's two-day HealthFront conference. Then, we spend the trend segment discussing the upcoming debut of the Secretary Kennedy podcast. No, this isn't a rerun. Sometimes things just never change in healthcare. There are a few other health-focused upfronts that take place during the spring, but none on the scale or scope of HealthFront. Every year that I attend, I learn something about the emerging trend lines in medical marketing, as well as how the industry can learn from other unrelated sectors of the economy. Also, the talent is a huge draw. Lineups in years past have included the likes of Selma Blair, Brooke Shields, Gabrielle Union-Wade, and Chelsea Handler, among others. This year's lineup includes former MLB star and co-owner of the Minnesota Timberwolves, Alex Rodriguez, Haider Warish, a cardiologist and program manager at ARPA-H, former NFL tight end Delaney Walker, as well as Essie Bracey, a former exec at Unilever. Just this week, PHM also unveiled a new branding identity to underscore that it is, quote, purpose-built for today's modern healthcare experience. It's great to have Andrea join us for this week's episode to preview PHM's 2026 Agency 100 profile, the upcoming HealthFront, and delve into 4 key aspects of her annual Disruptors list. Andrea, it's great to have you on the show. I think you are, since I've taken over as the moderator of the podcast, our most frequent guest. So it's always great to have you on here talking all sorts of stuff PHM. I know we're going to talk about the Disruptors. We're going to talk about HealthFront. But let's talk agency stuff. You guys actually get to be one of the first agencies to kind of preview your A100 performance. I know you talked with Bella, our new reporter, a couple of days ago. Talk about the year that was 2025 for you guys. Another year of growth. And obviously that doesn't come just out of nowhere. So what drove that?
Yeah, we definitely had another year of growth. But you know what? I think, Jack, what was really interesting about 2025 is how much our product changed and how much the talent that shape our product changed. So I was telling Bella, we made some really interesting hires that looked totally non-traditional. We hired a head of HCP, a chief HCP officer, which is a mouthful. But we did that because some of the speed at which the solutions are evolving, the speed at which technology is evolving, the pressure to use AI, but not for AI's sake, that's put in our business to act smarter, to keep ahead of the industry. I think has been so real that 2025 was a huge year of creation. So our growth, we experienced tremendous growth without just in the confines of our own walls, right? So our own clients, our existing client base saw exponential growth just in terms of how the level of sophistication that we applied to the business, the types of solutions and products that we were bringing to bear. Publicis, I'm sure you've seen, acquired a number of different types of companies. We added influencer marketing to our kind of solution set. The group's AI solutions expanded. All of these things kind of contributed to all of this, really fast growth. So I think that was huge for 2025. So I would actually say we spent more time inside than we did outside, pitching for new business. And we really spent kind of growing and maturing the product set and growing and maturing the team, expanding new skill sets and all that. And I think 2026 is going to be more, I'm going to see more of that too.
Yeah, I remember the last time we had you on, it was you and Brad because he had just taken over as chief investment officer. And it's amazing just to see, though it was 6 or 7 months ago, the amount of growth that you've experienced as an agency, both internally, and it's kind of where I want to pivot the conversation is externally too. You just released your list of the disruptors. You always put out your annual disruptors list. I thought it was fascinating just because it's a lot of what aligns with what I hear from other agency and brand side folks. But I had a couple questions just to kind of flesh it out a little bit for our audience. One point that stood out to me, you talked about the data disconnect and how everyone is trying to leverage all this data that they have. But obviously people always talk about garbage in, garbage out. I had a question for you just in terms of that gap between the trust that HCPs and patients have with health brands and how it's getting wider, how people haven't been able to really build a bridge across it. When it comes to data, how can that be remedied in the age of AI? I thought that was an interesting point you made.
What we don't have as an entire industry is we don't suffer from any kind of a lack of a lack of data or a lack of signal. I've said that, how many times have I said that? 1,000, I suppose. But what we do have is we do have kind of this the chaos that data can actually create is starting to put some pressure on the system. So everyone's gotten smarter and about accessing all of these different and disparate data sets, but bringing them together, I think, is where the friction comes, as well as, HCP in particular kind of lives connected between all of these institutionally separate data streams, right? So because we rely on, and it's not that we question the accuracy of it, but it is self-reported data that comes from multiple different disparate, disconnected black boxes. What we're trying to do, what all industries are trying to do is connect a unified intelligence graph or an identity graph across all of the different intersecting audiences. And obviously in healthcare, the intersecting audiences, if that graph is created in these black boxes, it creates a need to normalize it and to assemble it in some kind of standardized way. So one of the things that I'm excited about is that we're actually launching kind of some third-party validation standards that looks a lot more like the IAB, that looks a lot more like double verified type of stuff for HCP data, and that's something that is that we'll talk a lot more about at the HealthFront that's coming up. But we've been on this journey for the past several months to bring some kind of clarity to this thing that works as it is, but is very manual and is very slow. So the industry needs to move a lot faster and needs to take some of that manual work out of making sure that the data that we're making really big decisions off of is right and it's fast.
Yeah, I mean, you're talking about something that doesn't necessarily compute with this mindset of like, we're in the age of automation. Everything should move fast. Everything should be delivered automatically. So I think it's interesting you make that point. One other one that you brought up too was advising against static channels. And you said, seek consideration in places where people are open to engagement and participation. Can you talk a little bit about that? Because I do think that pharma and medical marketers in general do kind of say, hey, let's just go with our creature comforts. Don't rock the boat. Stay with the status quo. And you're basically saying like, we got to find our areas where we can actually connect with people. I want you to kind of flesh that out for our audience because I thought it was interesting.
Yeah. I think take off your marketer hat, take off your pharma hat for a second and think about how you might acquire an answer to a question that you have about your like in your own journey, right? So whether that's a health question or not, guess what you don't do? You don't wait until you see to see a TV spot that happens to target you in your moment of truth. I think that's helpful. That's one of those things that can certainly be additive to a journey. But I think what's very much changed so rapidly over the last couple of years is this kind of concept of what happens when people get into discovery mode. And what's really true about healthcare is that no matter what part of a journey someone is in on a healthcare journey, they are in discovery mode. They're trying to learn more. They're trying to get smarter. Whether they're in panic mode or understand mode or, seek support mode, they're in a moment of discovery and they're trying to understand, they're simply trying to unearth different truths. And so what that means in terms of contemporary marketing, we have to understand what discovery looks like, because it naturally goes into this really digital space and that naturally goes into, onto the phone and into AI. And how does large language models pick up the information, and how is the information being cast? And what's a brand's role in that? So when we're talking about channel planning, it really needs to follow the path of discovery that someone's naturally going to come upon, and how brands can shape that discovery and how they can shape that journey that someone's going to go on, whether it's a patient or a provider. There are so many new tools at the disposal of both patients and providers on their own discovery journeys, right? So we have to understand what has historically worked in channel-based media planning and understanding what's historically produced results, but how that behavior will change now that all of these utilities have changed and the way that people tend to behave has changed on their discovery phases. So I think there's better opportunities for a connection. There's opportunities to understand how audience move more continuously versus relying on data to kind of create this one singular look back moment, or one singular look back segment or audience segment, if you will, and to create those points of connection on the natural journey of discovery.
Yeah, and you had an interesting, it kind of dovetails into another point you made, which is we need to move from where ads run to where influence travels. I think that's the point you're getting at too, is like, I talk with marketers and they're like, oh yeah, like, HCPs have these blue jean. I'm like, of course they do. Like, they're off the clock. They go on Netflix, they go on social media, but like, it feels like it's almost become like an aha thing. And you thankfully were able to just spell out there and say like, guys, like we gotta rethink these sorts of things. And I don't know why that simplicity gets lost on marketers so much. I don't know if it's groupthink or just institutional stuff. I'm curious.
Yeah, I mean, I think it's breaking habits, right? So I think for all of time, we've sort of been you're limited to what you can do, and you're limited to what data tells you. And for all of time, marketers rely on proof. And we live and die by performance proof and performance metrics, and as we should, and we always will, but those have kind of changed, right? So the things we can't lose sight of how people are going to behave irrespective of what marketing playbooks tell us. And I think what you have to really understand and think about is narrative. People learn from the narratives that they can find. And if the narratives are out there being shaped by influencers or creators, or they're being shaped by, whatever large language models are picking up from the video content that's out there being created by other third parties, those are the narratives that are going to naturally be discovered on people's journeys. And that doesn't necessarily pay attention to historical performance metrics, right? That doesn't remember that last year your best performing channel was television. And it still may be. So it just becomes, part of, a reweighting or a reevaluation of how these things work together in concert, and how important, how your funnel gets reshaped, and does the funnel even exist anymore? And what groundwork has to be laid before you can rely on some of the big movers, or the reach vehicles, like your television, like your video, like your point of care, like your programmatic, like your social. All of those things are big reach movers. But what groundwork needs to be laid so that those narratives are well articulated, well followed, and that the brand can have a role.
I want to finish off with one more question about Disruptors before we talk about HealthFront. And it was an interesting one that you're talking about the future of DTC platforms. And obviously I think about that. I think about Lilly Direct or Pfizer for All. And I think Lilly Direct has led the way in a lot of different categories, especially as they've launched Foundeo this week. Curious what you make about their importance and just kind of how you evaluate their role here in the spring of 2026. Are you expecting to see more drug makers go that route? Is that something that you on the agency side have to kind of prompt them towards?
Yeah, I mean, I think that is a fundamental shift in accepted consumer behavior, again, in terms of how healthcare is accessed. So if you think, 5-7 years ago, it was something that people started to dabble in, but it was really nascent in terms of the adoption across the industry. And now I think it's kind of a universally accepted statistic. Almost 98% of people who do something in virtual care go back for a second time. So you're not seeing this like sharp drop off where people are trialing and never going back again. This is starting to become like intertwined in the fabric of how people expect and experience healthcare overall. I think it would be a miss not to understand. There's not one way to do it, right? So Pfizer, you mentioned Pfizer for All, you mentioned Lilly Direct. There are other manufacturers who go the partnership route, who are working with some of the third party platforms that are kind of, distributors or virtual care platforms in their own right that aren't necessarily tied to a singular manufacturer. And there's not one way to skin the cat. There's a lot of different ways to do it. We have a session coming up at HealthFront that will talk about the doors in, and all of the different ways people are accessing healthcare and the expectations and the opportunities that that's creating. I sort of look at it as not an emerging, but a channel. and a business partner and a thought partner and a strategic partner. Like it kind of fills a lot of different roles in both, the marketer's playbook as well as the human playbook. Do I think it's going to continue as a trend? I certainly do. I also look at the money. There's hundreds of billions of dollars being invested in these virtual care platforms. It's a huge growth sector. And I think that's because it's a part of the industry that's able to create a much more frictionless experience. It's helping fill different gaps of existing systems, and it's doing it in ways that I think we've seen start to really take hold. But now we're seeing it scale in ways that makes it not a test or a pilot or a one-off thing, but it makes it really critical to be thinking about how all of the different ways in, all of the different, patterns of experience and patterns of use change the traditional mechanism of make patients aware, make doctors aware, hope that conversation comes to a nice match at the binnel, and then ultimately make sure that that we're supporting patients in their quest to get the right treatment for them. I think that's only one possible scenario. There's so many other possible scenarios as to how that decision is made, and then ultimately how that patient's care is managed long term. So it's not just whether a product is transacted in a virtual platform or not. It's also, access to support programs, access to, all kinds of different types of patient services that can be done in these new spaces, and how do those all become a part of the new modern healthcare ecosystem, and how do we play there?
And it supports the depth too of like a brand, instead of just being like, oh yeah, totally. I go there for my allergy drug or for my plaque psoriasis. It becomes such a more thought out experience. Definitely.
Totally.
Transitioning a little bit over to HealthFront, we were talking offline that this is obviously a busy time of year for you. We're in the middle of Agency 100, end of our fiscal year. Same thing for us. How has it been going? How about we just start there? How's it been setting up HealthFront this year? It's the 6th iteration of it.
So every year we get to this point in time where I'm like, oh my gosh, how is this 2, 3, 4 weeks away? is this going to work? Are we going to come up? Are we going to finish it in time? And of course we got there again this year. Of course it was like, oh my God, we don't have this. We don't have, we have 80% confirmation on the tail end, but not 20. Are we going to get there? We always get there. And we are, in fact, really confident. We're really excited. But this year was also, the complexity of the topics that are on stage. Like what everybody wants to hear about, of course, is what's AI look like for real? What are what's happening on the regulation front? We'll have people that are talking about that. We'll have a gentleman, being interviewed by Daniel Nadler from Open Evidence. We'll have Haider Warish talking with him about the future of kind of clinical AI, which is super exciting. He's one of our keynotes. We've got some other, we've got sports is huge. Sports has been a huge sector for us. So we've got a lot of sports content. We've got a lot of content around, we've got a lot of stuff around this innovation. We've got some really exciting players from the space that you just talked about, from the virtual care sector, talking not only about what they're doing in their own vacuums, but how they're supporting different pharmaceutical manufacturers. So it's an exciting agenda, but it's been a journey to get there.
I look at our events team when they're setting up for the MM+M awards or any of our honorariums or programming. I don't envy that at all. So more props to you for being able to put that together. Talk to me a little bit too. You have, obviously the first one I went to, I think, was when you had Gabrielle Union-Wade and Brooke Shields for your keynotes. Last year you had Selma Blair, you had Chelsea Handler there as well. This year I know you've got Alex Rodriguez, Delaney Walker. You were talking about the focus on sports. Talk a little bit about that, because I'm a huge sports fan, and it's even if I wasn't covering this industry, I would have been like, hey, there's a lot more pharma and health involvement in sponsorships and collaborations. Talk a little bit about what they bring to the table when it comes to HealthFronts.
Yeah. So Alex Rodriguez is one of our, is certainly one of our keynotes, and we're super excited to have him, not only because of his sports background, but also because of his role as the chairman and CEO of AROD Corp, which is an investment firm that backs world-class startups and partners with leading global companies across real estate, sports, entertainment. And, we're going to be talking about the current media marketplace, especially when it comes to sports, including, what's happening with viewership, things like baseball's fractured streaming, and his role as kind of an owner or part owner of the Minnesota Timberwolves and Lynx. But he's an innovator. I mean, he's an entrepreneur. He's a business guy. So it's kind of an interesting angle, and we're excited to kind of dig into all of the different things that he covers in his role, from athlete to entrepreneur to investor to owner, and all the things that sports can mean other than just sponsoring sports, right? That's going to be a theme that you hear as well. We're going to have a lot of new conversations around how sports goes beyond just being in the sporting events, what that looks like when you're partnering with athletes, what that looks like when you're partnering with micro and macro creators in the sports space, what it means to sponsor and to go deeper into sports as a strategy versus just, again, buying sports. So I think, sports has been such a explosive growth area over the course of the last several years, but pharma is really leaned in right now to doing it right and doing it strategically to make sure it's not only an execution, but it's a strategy.
Yeah, the thing I always hear from folks is that it can't be just a jersey slap. It can't just be, oh yeah, we put our logo on the stadium, it's on a banner or something. It has to be a much more thoughtful and articulate relationship. And I'm looking forward to hearing how A-Rod, Delaney Walker are able to bring that in. There's also, I know that you have, F.C. Bracey is also going to be there too. Talk about their role at HealthFront. Yeah, AC is going to be speaking with Matt McNally, who I'm sure you know well as well. Matt is going to be interviewing her on a topic that I find particularly inspiring. I think, we've got this whole, a big theme of ours as a company right now is like modern healthcare marketing. What does that look like? But modern marketing as a whole is this like this complex, what she always says, which I really admire, is winning hearts, minds, and machines in the world of AI. So how do you, she's been so successful over the years and outside of pharma, in this concept of winning hearts and minds and really appealing through creative. And that's something that's really hard in health, which is so ironic, right? Considering that it's one of the most personal, one of the most human things that one can talk about, but it's really hard to build those connections. So she and Matt will talk creatively about how to win hearts and minds and machines, and how to do that as a transformational leader, to talk about how winning all of those things are critical for winning the path forward. That's excellent. I'm looking forward to that panel. And I'd be remiss to ask, is the guy from Publicis Commerce who always comes in there, he always has
Jason,
is he going to be?
He will of course be there. Jason Goldberg will make an appearance. We're going to shake it up a little, but he's got a spot on our agenda for sure. He's a fan favorite.
I was about to say, I always feel like I go in there, I'm like, I think I have an understanding of what he's going to talk about, and I leave there, I'm like, I didn't know.
I had no idea.
Yeah, I just scratched the surface. I want to ask you,
Jason Goldberg will shake it up every time.
He's the best. I got to ask you though, you guys are obviously, I wrote this last year as a recap from going to HealthFront. You guys are the preeminent spot for that. There aren't a lot of health focused upfronts. I think about the ones I went to last year. It was Patient Point, Digital Health Networks had it, but there's not one that I can think of from any of the Omnicom agencies, any from WPP, any from your holding company rivals, or even RealChem or Click. And so I'm curious, do you take pride in that? Is that something you'd like to see more of your competitors say, hey, we're going to put the priority and the emphasis out there? What do you make of kind of being singular in that landscape?
Yeah, you know what I think, as far as our supplier partners, I think our role is very different, right? Our role is to take the broad perspective, across all the verticals, all the suppliers, all of the channels, all of the opportunities in the space and bring it together and distill it and make it and make it really actionable for clients. Their role is to make sure that they're keeping on top of their respective remits in the landscape. And I think they do a really great job. So our role is to kind of bring the best of to the stage and make sure that it's not lost in the shuffle, because there's so much out there in terms of content. As you said, I do like to think we're the premier for what we do here. No one else does really do. And we of course are proud of that. And I also think, given our size and scale, and how we've really approached PHM. And I think Publicis has allowed us to really approach the marketplace pretty uniquely. So we have a bit of a different remit than some of the other holdcos, and we've got a unique opportunity to kind of bring together. Hopefully you notice over the years, we do a nice balance between HCP and DTC and emerging audiences and tech, and creative, the big buying, the small buying, the micro, the data. So we really do try to pull everything together versus going so deep on any one individual subject. We like to keep it moving because we've got a lot to get through, but it's also a really important moment and opportunity for connections because we're bringing together such a very purposeful swath of the industry between the client marketplace and the partner and supplier marketplace and the tech marketplace and of course our Publicis friends and all of the other parts of our own company. It's really the opportunity. We have hundreds of people there, and a lot of this. It's like the room where it happens, right? Mm-hmm. There's so many people that come out of there. I always say that what comes out of there is more than a great 2-day event. It's the start and the impetus for the next, several months worth of innovation and co-creation, because we are all about co-creation. Some of the products that we launched in the past and some of the products that you'll hear this year is co-created with the folks at that room, some of which will be announced that day, some of which will come from that day. Right. Mm-hmm. So that's what I am really proud of how everyone really kind of comes together and gives the space a platform and gives the vertical purpose. So, do I think other people should do it? Sure. Do I hope they do? No. I'm just kidding. But I do. I think it's great. I think it's great for the industry, for sure, for there to be more focus on how we innovate for health, because I certainly think it's an important vertical and an important space, and it deserves the time and attention.
Yeah. And I'm not just saying this because you're on the pod, but I obviously go to a lot of different industry events, thought leadership events and stuff. And I'd be hard pressed to find one that has that amount of value and breadth and variety like you guys do at HealthFront. So it'll be important for, obviously for our audience, April 29th and the 30th at the Glass House, 12th Avenue in New York. All that said, we've covered a lot of ground here, Andrea, but I want to ask a more important question. When it comes to May 1st, that Friday, after you're over the hump of HealthFront, how do you decompress? Do you just collapse on the couch? Do you pour yourself a glass of wine? How do you, after you've gone through this gauntlet of putting it all on, how do you just unwind?
Well, you know what? It's funny, Jack. I am actually going on vacation right before HealthFront.
Oh, really?
Mm-hmm. So, and I did it on purpose, but I like to be rested and prepared, so that I can make sure that I've got the stamina to get through the day. Because honestly, coming right off of HealthFront, we are off to the races. So I will certainly try to have a little cocktail and maybe go dark for a couple of days over the weekend, but just to recoup. But we're off to the races, starting that next day and that following Monday, because again, this is the impetus of how we're working with clients to get ahead. I mean, it's an upfront, so we are in heavy duty innovation planning mode right now, and this is the kickoff for how we're going to reach new heights in the coming year.
Yeah, you can pick whatever cliche you want. Grind doesn't stop. No rest for the wicked, whatever it is. It never stops at PHM. We'll include a link to the HealthFront registration in our podcast notes. But Andrea, thanks as always for coming on the show. Can't wait to see what you guys have on tap. Can't wait to see what weird food display you guys have there. That's always something to look forward to. The
acrobatic food, right? Everybody likes the acrobatic food.
That's the best part of it. But thank you again for coming on the show. Really appreciate it.
Looking forward to seeing you there.
For our trend segment, we are welcoming another health podcaster into the health podcasting sphere. You'll recall about a month ago, we had the folks from AbbVie on to talk about their branded podcast. And this week, probably by the time that you listen to this, honestly, you will have the first episode of the Secretary Kennedy podcast. Kind of an inevitability for an administration that is largely run by media types and podcasters. I'm sure Kash Patel is somewhere at the FBI headquarters kicking himself that he has not started the first Trump administration official podcast, but it's coming out into the world. We don't really need to do an episode by episode review. I think that would drive each and every one of us insane to some degree, but we can talk a little bit about the high level meaning of it from a health communications perspective and maybe some of the topics we expect to see. I imagine that we're going to get plenty of conversation about vaccines, about peptides, all of that. Madden, I want to throw it over to you though, because I think your exact reaction when we talked about it in our G chat was like, Jesus, like we're getting a Secretary Kennedy podcast. And now that you've had a couple of days to digest it, what's your read on this?
Well, when I said Jesus, this was before the infamous meme of the healer in chief was presented itself. Yeah, I mean, look, this is the thing about social media, right? And about the internet is everybody's a publisher now. Everybody's a podcaster. You don't need to go through the traditional routes, which is good and bad. It's like, the diversity of voices on different topics is always or was always a good thing. The problem is when they can promulgate ideas and schools of thought and information that is just plain wrong. And that's my big fear for this podcast, is that a guy with a famous name and a big job and a platform is going to use that opportunity to just spread lies, basically. I mean, let's call it what it is. I don't, he hasn't done it yet. I haven't heard anything. So maybe I'm going too far in using that word, but I just, to go out and say that if he repeats some of the things that he's already said, he will be spreading lies. So it's potentially very scary.
Yeah, like I said, we don't have to do an episode by episode breakdown because, we already have a pretty good track record of obviously where he stands on a number of health issues, both from his tenure as HHS secretary, but he was also in the podcasting game up until when he got nominated in mid-November of 2024. Like you can go back, he has a whole archive on wherever you get your podcast after you finish this episode of the MM+M podcast. You can go check those out. But also, he's been on the Joe Rogan Experience. He's been on all these different podcasts talking about all sorts of range of health subjects. Again, some that we agree with in terms of like, yeah, that's something where the administration should take a more pointed focus and try and move the needle from a health perspective, and some that are so out of left field, wacky, off the walls, deviating from mainstream that you're like, okay, now it's going to get the official like HHS bumper on it. That's obviously concerning in that way.
Well, he also has used since he's been secretary, he's used podcasts to basically to break news. He used a Joe Rogan podcast in late February to talk about certain peptides being reclassified. So he's an astute user. Like a lot of people in the Trump administration, they are astute users of social media and alternate publishing platforms.
And that's where I want to bring Bell into this conversation, because we always have this conversation of like how health brands should be using all these different levers. Like it's not enough to just run your 60-second ad on linear TV and be like, oh yeah, people are now going to suddenly have a better understanding about GLP-1s or plaque psoriasis drugs or anything. And that's been interesting talking about the social media aspect is FDA has come out there in recent weeks with their kind of weekly wrap-ups. You want to give our audience a little bit of a taste of what that is? Yeah, so FDA's been publishing what's called FDA Wrapped, and it looks like sort of Gen Zers going over the drug approvals of the week, sort of touting, a lot of them are rare disease drugs, which I have to wonder if it's a little bit of an effort to reduce the criticism around the agency and not approving, a number of rare disease drugs. But it's just a very sort of user-friendly, engaging, like I have a very short attention span. I had no problem getting through it, graphics, et cetera, et cetera. And actually, I think, it's both promoting the agency and the work of the agency, but it also has like a bit of an educational tone to it. And so I can see why it resonates with people. And they haven't been doing it for a super long time now, but I'm curious to see where they take it. Yeah, if there's one thing you can say is that the media savviness of the Trump administrations, both 1 and 2, is on display there. And it is one of those things where, again, like, we were talking in our one-on-one last week, like, oh, Pfizer's done a lot more on TikTok. Well, that's nice, but it's also 2026. Like TikTok has been the top social media platform for 7 years running now. And it's only now that they're actually like getting that messaging out there. Moderna, a couple of years ago had a YouTube series that last I checked, they haven't updated since like July of 2024. So it's been a minute. And it's interesting to see the FDA under this leadership taking that perspective. Like, I couldn't imagine Xavier Becerra or Alex Azar before him having a podcast. I absolutely could imagine that from RFK Jr. That's very much within his wheelhouse.
There's also, the lesson for pharma here is if you don't tell your own story, someone's going to tell it for you. And that's what's been happening. So, if you haven't updated, if you have a social media channel and you haven't touched it in 2 years, you've got a really big problem, I think.
I'm working on a story this week also about the trade group Bio. They're doing a campaign around just basic like scientific advancement and the importance of funding research and funding, the development of these drugs. And it's not promotional of any one product or company. It's literally just, they told me, targeting lawmakers, people in positions of power like that, and also just people to rally around their lawmakers. And so that's a little bit different than pharma, sort of like telling the story of, their own R&D, their own progress and whatnot. But I think it is a very unique sort of spot we're in right now, where those biotech and pharma organizations are on the defensive, sort of like, don't take our funding away. Here's the really important work we're doing. And maybe actually that will be good in making pharma and biotech less reactive from a communications perspective and more proactive to telling their story. Well,
especially a week after Stephen Ubel stepped down as announced he will be stepping down as the head of pharma at the end of this year. And like, obviously he came in and like the 2015 landscape that he inherited is completely different, both in terms of like who your allies and who your opponents are and the different mechanisms that you have at play. So I think your point's well taken there. Bill, I want to ask a follow-up question too, because one thing that was interesting when you were diving into the FDA wrap stuff is for all of the positives that you hear from this administration about we need to be free speech warriors and any speech goes, and it's the whole reason Elon bought Twitter. Not exactly the case with that FDA rap video.
I was looking at some of the videos just before we came on the podcast just to see, what the reactions were in the comments. And I noticed that there are some negative comments, but the comments are limited across the page. And so I'm really curious about that decision. It doesn't exactly lend to, that idea of free speech and letting, people in the a lot of the comments are like, look at this drug, review this drug for this indication, stuff like that. But there's not a lot of negative stuff on there.
Matt, I want to ask you that question because I had a sponsored breakfast roundtable when I was at Transform, and that came up in the conversation about how pharma exists and interacts on social media. If you are Bristol Myers Squibb, should you, when you put your posts up on Instagram, on Twitter, on LinkedIn, should you have your comments open? There was a healthy back and forth of like, well, it's good because that way it doesn't seem like you're hiding anything. But like, what if people go in there and they're just trying to spam and bombard your page with misinformation? Like, I don't know where you come down on that, where it's like, is it a benefit to be more open than not? Or should you have a little bit more control over the discourse in your posts?
The answer is yes. No, I think anybody who publishes anything needs to reserve the right to say, look, if you come on my comments page and say that Martians are gathering on the dark side of the moon to invade us, I'm probably going to take it down, right? Or probably not let you post it in the first place. But one of the issues that pharma is dealing with is a perceived lack of transparency. So I think that allowing critiques, criticisms, and comments that aren't, completely rosy, I think that's a good idea. I think it shows that you're open to debate and that it also provides a forum for you to be able to address a concern head on and say, hey, thanks for your comment. Here's actually what's happening, right? But if someone comes in with, you don't need this drug, just use ivermectin and turpentine, you'll be fine, then, reserve the right to not publish that.
I remember when we were first talking about the FDA wrap stuff, Bella, like I had said, isn't it interesting, like to your point, like these are like clearly Gen Z, if not like cuspy millennials that are out there with the broccoli haircut and that kind of like rosy, I've been raised on an iPad face saying like, oh yeah, like here's the approval that came across and stuff. And it's like, wouldn't that be a benefit if you were, I don't know, Novo Nordisk or Novartis or Roche or something, to have like when people go out there and they're like, oh, like we're going to spread this information or accuse you of this, to have that as your digital spokesperson? I don't know. Like it's not that far afield to consider.
Yeah, it's interesting. I was also looking at Pfizer's TikTok or Instagram before this, and I saw they had a couple sort of like, this is how drugs get named. This is how like we're taking you through this approval process and whatnot. So I guess for folks listening, like maybe Pfizer is an example of drug company that's venturing into more casual communication and whatnot. They don't quite have the same iPad, obsessed Gen Z. iPad kids is what I want to call them, because I'm an iPad kid.
You're allowed to say that.
I'm an iPad kid, so I claim that. But it's really interesting. And we talked a fair bit about audience and like who they're trying to reach, and came down to sort of the conclusion or the guess that maybe it's both young consumers and also moms.
Yeah.
Doing it for the moms.
No, the Maha moms are, I can tell you, like having a few that are in my orbit, whether in my family or friends and stuff, like the Maha moms are the backbone of this movement. And RFK Jr. knows that better than anybody else as the spearhead of it. Do the pharma companies that are, going to be the targets of this? And I guess that's kind of where I want to position the conversation to wrap a little bit. Is he said in the trailer for the podcast, like, I'm going to name names, like we're going to name the culprits that are driving bad health comms and everything. And it's interesting that it comes at the same week that our friends at PR Week are going to have their crisis conference. And it's all about like, how do you respond when you're in the crosshairs? Like, what if you are Pfizer and it's episode 2 or 3 and RFK Jr. goes out there and says like, the harm that they cause, the deaths that they cause because of their COVID vaccines, like how do you think that I'll throw it over to you, Matt. Like, do you think these drug makers should already have like their press statement or their responses in mind in case that comes to pass? I don't think it's out of the realm of possibility.
Well, they certainly need to have a full pot of coffee in the war room, right? because it's coming, right? And this happened last fall around Tylenol, saying that, look, Tylenol, don't take Tylenol if you're pregnant, because it could cause autism in your child. You have to be ready for stuff like that in this environment. And the interesting thing is that, if there is a poster child for crisis communications, it's Tylenol. Going back to the 80s, for the tampering, the tampering fiasco that it had to deal with. So you need to be ready for it. It could come out. The problem is, like, you could say like, okay, there's been a lot of talk and a lot of friction around this one particular topic, like mRNA. So if you're Moderna, you probably have someone warming up in the bullpen, to put it that way. Mm-hmm. But something could come completely out of left field, right? And it could be like, something as far-fetched as, the makers of IV solution, are causing all kinds of problems with our health. It's something that's just completely nonsensical. You can't be ready for that. You can be, like I said, you can be warmed up and ready to go, but you can't have a white paper prepared for something like that. And you just never, if he's saying, I'm going to name names. Yes, there are some usual suspects, but it could happen to anyone.
Defamation cases are going to fly.
Yeah.
The defamation cases are going to be plentiful, I'm suspecting.
And I think the other side of it too is like not only being named as the enemies, but I think about somebody like GSK where suddenly you're in the crosshairs like you didn't expect. Like when the autism announcement came out, like Kenvue had a couple days notice and were able to go out there and say like, here's our press kit. They had a whole PR campaign. I certainly saw it more on my social media than I ever did before about correcting the record about Tylenol. And again, I think that speaks to their legacy as a brand. But when the Trump administration came out and said, oh, we're going to have this 20-year-old GSK drug be the cure for autism. And suddenly GSK has to get out there with their communications, be like, whoa, we did not ask for this. Like, we're going to go through the proper channels and everything. Like, it goes both ways where you can be both angel and devil.
Yeah. And who is in charge of regulating and policing false claims that the FDA makes if it's the FDA?
Yeah. The call is coming from inside the house.
Yeah, right? Exactly. For example, like those indications, like for autism, like the various drugs that have come up over the years for that, like if he says something about that on the podcast, I mean, we just saw Immunity Bio get that sanction about misstating indications for its drug. Like, who's responsible for that? Who's responsible for being like, I'm going to send you a letter myself?
That would be a great first episode. Then get Patrick Soon-Shiong on there with RFK.
Yeah.
That would do numbers in our niche little part of the industry. So I think we're going to leave it there. I think we've covered a lot of ground. And obviously, like if there's something that's really meaningful for our side of the industry, when the podcast comes out, we will tap into it. If it's just a lot of conversation about doing push-ups in jeans and drinking raw milk
at the airport,
we'll pass on that. But certainly keep an eye out from the marketing perspective and from what it means for drug makers.
I think he was doing pull-ups at the airport.
Yeah, it's pull-ups at the airport, but he was doing like the jeans in the sauna with Kid Rock. Right. That's what I remember.
But I'll say it. I said it before. I'll say it again. As a former CrossFit coach, I'd no rep that guy a million times. His form is awful.
We can't even get him started on Hegseth. That could be a whole other episode.
No, actually, Hegseth does a really nice push-up. Hegseth has really good forms on the push-up. He's protecting his shoulders. He's doing a really good job keeping the elbows in.
When we have a slow time during the summer, we'll have Madden go through all of the Trump administration officials' workout routines and rank them.
Can I do it shirtless?
Yeah, that would only make sense in the world. Awesome. I think that's where we're going to wrap it here. Thank you for joining us on this week's episode of the MM+M podcast. Be sure to listen to next week's episode. We'll be joined by Timothy Lee, the Chief Commercial Officer at Invivid. Take care, everyone. The MM+M podcast is produced by Bill Fitzpatrick, Gordon Thaler, Lesha Bushek, and Jack O'Brien. Rate, review, and follow every episode wherever you listen to podcasts. And be sure to check out our website, mmm-online.com, for the top news stories on the pharmaceutical industry and medical marketing agencies.